Are you feeling constantly drained, lost your energy, lost your strength, or lost your sex drive, despite managing your kidney disease? Well, you're not alone. Up to half of men with chronic kidney disease suffer from low testosterone levels. This is a hidden condition that many patients never get diagnosed or treated for. Could this be affecting you? And is testosterone replacement therapy safe for your kidneys? Let's look at the evidence. Hello, I'm Dr. Hashmi, a board-certified nephrologist and obesity medicine specialist who's treated thousands of patients with kidney disease over my career. Today, I'm talking directly to you, men with chronic kidney disease, about a critical issue that might be significantly impacting your quality of life: low testosterone. In my practice, I have seen how this one aspect of kidney disease can have such an enormous impact on patients' energy, mood, and overall well-being. In this video, you'll learn what testosterone actually does in your body, why your kidney disease makes you vulnerable to low testosterone, how treatment could improve your energy, strength, sexual function, and bone health, what are the risks associated with this type of therapy, and what does the very latest research tell us about safety. The goal is that you will have the tools to have a conversation with your own doctor. If you've been struggling with fatigue, weakness, or low mood that your other treatments just aren't fixing, this is the type of information you want to make sure you're armed with. All right, let's start with the basics. What is testosterone? Testosterone isn't just for bodybuilders or athletes. It's essential for your everyday energy, mood, and health. Think of testosterone as your body's natural builder hormone. It helps construct everything and maintain everything from muscle to bone to your sex drive. Testosterone is primarily a male sex hormone produced mainly in the testes, essential anabolic hormone that is responsible for development of male sexual characteristics, maintenance of sexual function and libido, regulation of muscle mass and strength, bone density and mineralization, fat distribution and metabolism, red blood cell production, mood, energy, and brain health. Now, normal testosterone levels are between 300 to 1,000 nanograms per deciliter for total testosterone versus free testosterone, which is the active unbound portion, is about 9 to 30 nanograms per deciliter. The thing to note about testosterone is that the levels naturally decline as you get older, 1 to 2% per year after the age of 40. But with chronic kidney disease, this decline accelerates significantly. It's almost like your kidney disease is fast-forwarding the aging process for your hormones. So let's get into hypogonadism in chronic kidney disease. What's the prevalence? What are the causes? It's important to understand just how common this problem really is. You actually might be surprised by these numbers. In fact, when I was doing the research for it, I was pretty shocked by them. Up to 50 to 70% of men with advanced chronic kidney disease have low testosterone. And in dialysis, these rates are even higher. In fact, they're greater than 60%. But what's really interesting is even after kidney transplant, hypogonadism can still persist in many patients. So if you're somebody who's on dialysis, there's a better chance than not that you are probably suffering or affected by low testosterone. Now, you might be wondering, well, what does kidney disease have to do with testosterone levels? Well, it turns out there are several important connections. Let's talk about the causes of uremic hypogonadism. This is just a medical term for low testosterone in kidney disease. Number one, there's a disruption of the hypothalamic pituitary gonadal axis. This is your hormonal command center. Number two, there's uremic toxins that directly impair testicular function. Number three, there's reduced clearance of prolactin, which inhibits testosterone. Therefore, you end up having more of it, and you're inhibiting testosterone even more. There are medications, antihypertensives, phosphate binders. Number five is malnutrition and chronic inflammation. Number six is obesity, which, by the way, is very common in chronic kidney disease patients. And number seven is other comorbid diseases, things like diabetes, hypertension, which can lead to vascular diseases. Now, studies show that low testosterone correlates with chronic kidney disease progression and mortality. This conversation about testosterone replacement isn't just about feeling better. It might actually impact your survival and kidney function. Research indicates, and this is from more recent research, that testosterone deficiency might not just be a consequence, but maybe even a contributor to kidney disease. So in other words, low testosterone may actually accelerate chronic kidney disease, and then chronic kidney disease may actually make low testosterone worse. Let's talk a little bit about the clinical manifestations and impact on quality of life. So how do you know if you're affected? Well, let's talk a little bit about the signs that might indicate low testosterone is affecting your quality of life. Probably the first sign that people notice is problems with sexual function. Erectile dysfunction affects greater than 80% of the folks on dialysis. Decreased libido and decreased sexual satisfaction, fertility issues. These issues can significantly impact your intimate relationships and self-esteem. Then there's, of course, the body composition changes. Have you noticed that your muscles are getting smaller despite you trying to stay active? So in other words, there's accelerated muscle wasting or sarcopenia. There's increased visceral fat. There's the protein energy wasting syndrome. And once again, I want to emphasize that this isn't just about appearance. It affects your strength, your mobility, and most importantly, this affects your independence. And let's not forget the psychological effects, that constant fatigue, that brain fog that just won't go away. And a lot of times people attribute that to just kidney disease when it could be kidney disease, but it could also be low testosterone. There's that constant fatigue, the low energy, the depression, the mood changes. Also, that reduction in cognitive function, meaning your ability to think clearly. Then there's the decreased motivation. In other words, you just don't feel like wanting to do things. And this concept of decreased motivation is one of those things that I tend to hear a lot in my practice, and patients describe that as one of the most difficult parts of kidney disease. Then, of course, there's the bone health issues. There's accelerated bone loss. There's increased fracture risk, which, by the way, is already so high in chronic kidney disease. Your kidneys already affect your bones. We've talked about the active form of vitamin D, 1,25-hydroxy vitamin D, the role that it plays in your parathyroid gland, which is next to your thyroid. It controls bone health. Well, low testosterone then compounds that problem with weak bones. Then, of course, there's the metabolic effects. There's worsened insulin resistance. There's poor lipid profiles. There's increased cardiovascular risk because of low testosterone. And the thing is, all of these things are happening silently, and you don't really know about them, and yet they have so many consequences. So then let's talk about the benefits of testosterone therapy in chronic kidney disease. Men who have done testosterone replacement therapy, this is not, once again, bodybuilders or athletes. This is just trying to get to the normal range. So men report that one of the most meaningful changes is improvement in their sexual life. Studies also show that there's improvement in erectile dysfunction. Skiba and colleagues from 2022 demonstrated significant increase in scores from baseline to 12 months after testosterone replacement therapy in hemodialysis patients. Patients report improved libido, improved sexual satisfaction. They have enhanced quality of intimate relationships. So just step back for a moment and think about this. Imagine that you regain one of the most important aspects of your life. And it's an aspect that kidney disease has been robbing. But it doesn't just stop with sexual function. It also goes to muscle mass, physical function. Especially in kidney disease, my male patients start to report that, look, my body isn't as strong as it used to be, no matter how hard I try. Well, testosterone helps to counteract sarcopenia. It counteracts that protein energy wasting syndrome. It increases muscle synthesis, improves strength, improves physical performance. It may increase exercise capacity. But most importantly, testosterone therapy has the potential to increase mobility and independence. In other words, patients who do this, they come back and report that they feel stronger within just months of starting treatment. Let's talk about bone health. We said your kidneys and bones are closely linked, and testosterone helps protect all your bones in your skeleton. It increases bone mineral density. In other words, makes the bones tougher. So this results in a lower fracture risk. Now, testosterone is not therapy by itself. It can be complementary to all the other bone health measures that we take in chronic kidney disease. And this becomes really important as patients with chronic kidney disease oftentimes suffer from something called renal osteodystrophy, which is basically brittle bones. What about low red blood cell count or anemia? A lot of our patients on CKD, they still feel tired despite their anemia treatments, and testosterone has the potential to help because testosterone stimulates red blood cell production or erythropoiesis. And so what that means is that folks on testosterone may need less erythropoiesis stimulating agents or ESAs. And of course, that can translate into potential cost savings, can also be less side effects from ESAs, but most importantly, it translates into better energy for the patient. How about just the most basic stuff? The metabolic effects. Well, what you find with testosterone replacement is your insulin sensitivity improves. You have better sugar control in diabetic chronic kidney disease patients. Your cholesterol levels actually improve. The lipid profiles get better. Visceral fat goes down. And so overall, your metabolic health is actually improving. But it's not just improving inside the body, it's translating into physical things that you can see. You have better mood, better brain function, you're able to perform better. And so what does that translate into? It's psychological benefits. In other words, all these things of mood, energy, clearer thinking, imagine how much better our patients would feel and how much more compliant they would be if we're able to address this issue. So this concept of depression that a lot of our chronic kidney disease male patients are going through. Remember, men hardly ever talk about all of the things they're suffering through. They just kind of hold it inside. They feel like it's the macho thing to do. But the reality of it is you do want to let it out. You want to get help. You want to make sure it's being worked on. But if you have low testosterone, that in itself can put you in a bad place along with everything else that's going on. So when you replace it, you get more energy, you get more motivation. Overall, you get better lifespan and health span. In other words, your quality of life goes better. And the thing that I've heard from patients is many patients describe this as feeling like themselves again. Now, what about the potential impact on chronic kidney disease progression? Could testosterone therapy actually protect your kidneys? Well, this is where the research is still pending, but it's interesting. There's a study by Sharma and colleagues that found that testosterone replacement therapy was associated with delayed progression of chronic kidney disease. Studies have shown that men who received testosterone replacement therapy have slower declines in their GFR compared to similar men without treatment. Now, once again, it must be emphasized, this is not some crazy high levels. This is just taking patients who have clinical manifestations of hypogonadism who are being brought into just the regular range. But everyone wants to know, is it safe? And so, as you know, in every time I try to do any kind of a video, I always try to give you the pros and the cons so you know all of these things. This is one of the most debated topics out there, and I can tell you, even myself, I've had a lot of biases against using testosterone, but this is where you have to put your biases aside and you got to look at the research. So what is the research around this? Well, let's take a look at some of the recent data from the TRAVERSE trial. What we're finding is that testosterone actually appears safer than previously thought. A lot of the bad press around testosterone is folks taking it to make it really high levels. We are not talking about that. We're just talking about getting men into the regular range. And so the recent TRAVERSE trial 2024, it found that testosterone replacement therapy was non-inferior to placebo for major adverse cardiovascular events in high-risk men. In other words, giving testosterone did not change the outcomes compared to placebo. It didn't cause more heart attacks than placebo. It didn't cause more strokes than placebo. And there's other studies that even suggest there might actually be cardiovascular benefits from the better lipid profiles. Now, in some studies, there has been a very small risk of increased atrial fibrillation, and there's even been episodes of acute kidney injury in patients who got either dehydrated or other things happened, but those were very, very small, and they can be controlled because those were when patients were taking too much testosterone. And this is why whenever you do something like that, you need to make sure you work with a physician, either a nephrologist or an endocrinologist. So what's the take-home message here? You can think of it like this. If you already have heart disease or risk factors, testosterone therapy doesn't appear to make your major risk factors worse, but you still need to monitor the levels carefully and you need to work with an experienced provider. Now, what about polycythemia or too much red blood cells? This is the most common side effects. And once again, this requires regular monitoring. And this happens to be the most common effect of testosterone replacement therapy, but oftentimes it's because of the fact that people are taking too high of a dose. And so what are the risk factors? Well, it's seen more with injectable formulations than anything else, and of course higher doses, and it's seen more in men over the age of 65. So remember, chronic kidney disease, there's always anemia, and testosterone replacement therapy may actually be beneficial because it can increase your red blood cell count. But you have to monitor your blood cell counts. And that's why this isn't something you want to do on your own. And remember, different testosterone formulations will impact your red blood cells differently. There is a 2023 study. They found that polycythemia during the first year of testosterone replacement therapy, it increased the risk of blood clots, and even major adverse cardiovascular events like stroke, heart attack. So as a kidney patient, remember, this is an interesting twist because many patients have anemia. So a little increase in red blood cells might actually be helpful. It's just that if you're not monitoring and you're taking higher doses and you're older, this could become too high, which can increase the risk for atrial fibrillation or even blood clots. Now, I would be remiss not to talk about prostate concerns because there's been so much fear about prostate risks. And once again, the evidence is there to contradict these fears. There's lots of historical fears and biases. Like I said, I have my own biases that it might increase the risk of prostate issues. A lot of healthcare providers still worry about prostate cancer risk, but the evidence is lacking. There's no evidence that really shows testosterone replacement therapy increases the risk for prostate cancer. Now, it can increase the risk for benign prostatic hyperplasia, BPH, and this definitely happens at higher doses. But once again, the studies don't show this. Now, you do want to have your PSA checked. Make sure that you're doing this under a qualified physician who has experience. But if there is somebody out there who has prostate cancer, then we would definitely say don't use testosterone replacement therapy. So if you don't have prostate issues, you're fine. If you already have prostate issues, meaning enlarged prostate, you want to make sure that you're getting proper attention to it and have a conversation with your doctor because it may or may not be right for you. What about fluid retention? As you know, with kidney patients, you have to be so careful about fluid. And this is something we watch very carefully. And testosterone can cause edema or swelling in CKD patients. And if they have heart failure, it can actually worsen some of those symptoms. So once again, you have to watch it carefully. You have to individualize it for each patient. The good news is that the studies show that in chronic kidney disease patients, if you're monitoring the levels properly, there's very little impact on fluid retention. Now, what about those people who have sleep apnea? Remember, that's where people can stop breathing for a few seconds while they're sleeping. So in those cases, what you want to know is that in some cases, testosterone replacement therapy can actually worsen sleep apnea. And because sleep apnea is common in chronic kidney disease patients, you have to monitor it carefully. And this becomes even more important in patients who might have resistant high blood pressure because of the fact that if they're resistant high blood pressure, they have some excess weight, their necks are smaller or wider, you want to worry about obstructive sleep apnea. And remember, sleep apnea can increase blood pressure and it can absolutely affect heart health. So you have to take this very carefully. All right, how about fertility? For younger men who want children in the future, this is something to consider carefully because taking testosterone can suppress sperm production. So this becomes very important in younger chronic kidney disease patients. Remember, we're not saying take testosterone for everyone. What we're saying is if you have a clinical need for it, then yes, you should take it. And if you're very young, you need to think twice about taking it, especially if you want to have kids. Now, the good news is generally when people stop TRT or testosterone replacement therapy, the sperm amount actually comes back. Fertility does come back. Now, as always, I'm going to have references to all of these studies, but a couple of things to point out. Kiba and colleagues 2022, they studied TRT in both hemodialysis and advanced CKD patients. They found significant improvement in symptoms without increased risk. There weren't any adverse effects on PSA levels or fluid retention, and they saw improvements in sexual function and quality of life. The Traverse trial 2024, largest cardiovascular safety trial of TRT to date. It included men with chronic kidney disease stage 3 as a high-risk population. And once again, they found that TRT was non-inferior, meaning it didn't cause more or anything like that compared to placebo for cardiovascular events. So there was no increase in things like heart attack, stroke, They did see a small increase in atrial fibrillation and acute kidney injury, but those were really in people who had higher levels or higher doses. There's the VA database study published 2020. This was a retrospective analysis of testosterone levels in U.S. veterans with chronic kidney disease. Once again, interestingly enough, they found that TRT was associated with the delayed progression of chronic kidney disease. Now, they did not find the polycythemia or increased red blood cells, but that may be because the doses they were using were appropriate, and what they essentially suggested was that there may be some kidney protective benefits. So what's the latest safety guidelines? Well, the Endocrine Society, they recommend regular monitoring of testosterone levels. They recommend monitoring hematocrit levels or red blood cell levels. And if your hematocrit, is greater than 54%, you need to go ahead and stop. PSA is monitoring in the appropriate age groups, but as always, you need to individualize the risk and benefits conversation. And if you are somebody with chronic kidney disease, remember, you want to coordinate between the kidney doctor, the nephrologist, and the endocrinologist, and make sure you're talking to an experienced physician. So who are the appropriate candidates for testosterone therapy? Well, it's men with chronic kidney disease who have documented low testosterone levels, who are symptomatic, meaning they have sexual dysfunction, fatigue, depression, and low levels, who have accelerated muscle wasting or sarcopenia, who have bone health concerns, and who have completed appropriate screenings. In other words, they don't have prostate cancer. We've checked out their numbers already to make sure they're safe. And once again, contraindication, the opposite side. If they have obstructive sleep apnea, that's a contraindication. Active prostate cancer, severe untreated benign prostate hypertrophy. If their hematocrit is greater than 54%, if they want to have children in the near future, or they're concerned about their fertility in the near term, this is not it. If they have uncontrolled heart failure, or if they've had any kind of a recent cardiovascular event within the last 3 to 6 months. So it's very important, once again, to make sure you confirm that they have low testosterone levels. And you want to use morning samples. You also want to make sure that you measure the free testosterone levels, because those are more relevant in chronic kidney disease, and use some kind of a validated questionnaire to assess for their symptoms. You need their baseline blood count to look for hematocrit levels, PSA levels, metabolic parameters. You want to assess what their cardiovascular risks are like. And then the most important part is you got to discuss realistic expectations and the fact that they need to come back for regular blood tests. Because if you have unrealistic expectations, you're going to be disappointed. This isn't miraculous, but it can certainly make a difference. So let's get into the clinical approach to treatment. Remember, there's all sorts of formulations. There's the injectable testosterones. The advantages of those are they're inexpensive. There's less frequent dosing, often once a week. The disadvantages are when you take it, there's a rapid rise and then it goes down right away, so it fluctuates level. There is a higher risk of polycythemia with injectable testosterone. Those are names like cypionate or enanthate. Now, then there's the transdermal gels or patches, which are very common. The advantage of these guys is the levels are much more steady. There's a lower risk of your red blood cells becoming too high. Now, in some cases, the cost is definitely an issue, but the cost is coming down. Of course, you have to be careful if you're applying it to your skin that you're not accidentally transferring it on to your partner or anything else. And then now there's even other forms. There's subcutaneous pellets. There is stuff that can go in the mouth or the nose. But the bottom line here is if you're doing it for chronic kidney disease, start at lower doses. Make sure you check blood test level, titrate based on symptoms, and you're really targeting for a mid-normal range for their age. And as far as monitoring goes, it's recommended that you want to check the testosterone levels every 3 to 6 months. And once they're fairly stable, then you can even go to once a year. With hematocrit, same thing. You want to go ahead and test every 3 to 6 months to make sure that it's okay. PSA or prostate-specific antigen, that's based on the guidelines that are already there. Your doctor can help you how often to check. In terms of cardiovascular assessment, that should always be checked at every visit. Now, how long to take it? Well, it is essentially a long-term treatment. So once you start, you're pretty much on it for the long term. And benefits usually go away pretty rapidly after you discontinue. All right, let's bring all of this together in summary, and what are the key takeaways you want to know? First, testosterone deficiency is very common in chronic kidney disease. There are all sorts of negative impacts on your quality of life and your overall health. And testosterone replacement therapy offers lots of benefits for many of the biological systems. And now we have more data, especially the TRAVERSE trial from 2024, that gives us reassurance about cardiovascular safety. But you've got to individualize this approach. You got to have an experienced doctor that you can have a conversation with. Now, of course, we need longer studies in chronic kidney disease population. We need to understand, how does testosterone potentially reduce chronic kidney disease progression? What's the renal protective mechanisms? So more to come in the future. And as studies come up, of course, I'll share it with you. But the bottom line here is testosterone replacement, or testosterone deficiency, is an underdiagnosed, undertreated aspect of chronic kidney disease that not a lot of people are talking about. And with proper patient selection, with monitoring, testosterone replacement therapy can significantly improve quality of life. Now, you do want to have a multidisciplinary approach between the nephrologist, the endocrinologist, but keep in mind that we need to make this issue come to light. Like I said in the beginning, I started with lots of my own biases. I'm starting to see the research behind it and to say, look, it's okay to have biases as long as you understand them and you're able to overcome them, and you can put the patient at the center of the conversation. With that, I want to thank you guys so much for checking out this video. If you found it valuable, please hit that like button, the subscribe button, and share this with your colleagues who may need help. And as always, I end up every video with the same message, which is more so than how smart you are, how much money you have, all of those things. The most important thing you can do in this world is be kind. It will help you live longer because of the fact that it will reduce your stress. It will give you genuine happiness. Express gratitude. So with that, thank you for allowing me to share my journey with you guys, for being so supportive. And as always, for sharing a few moments with us, just so that in this life that we're going through, we all have the opportunity to take a minute to make somebody's life just a little bit better. So with that, thanks as always. I'll see you guys next time.